Hi, it's Dr. Kate, and today's podcast episode, I wanted to kind of go over what I've been working on. So if you have been following me, you might have seen that I do have like a monthly membership called Core to Floor Restoration, and that is for your pelvic floor and your core. So for people that have C-section rehabilitation, pelvic floor would be like leakage and pain with sex and those kind of things, and also Diastasis Recti can help with some of that as well. But I wanted to find a program suitable for pregnant patients because I treat a ton of pregnant patients, and mostly with the way insurance works is that a pregnant patient won't come into me until they have an issue. So they're in pain, and ideally you would be working on certain exercises, mindset, movements, and those kind of things when you're pregnant before you have pain. So this is to prevent pain. So if I could get to pregnant people before they had an issue, it would make it so much easier to prevent the issue rather than fix it later on. Now, not to say that this program can't work for someone that's already experiencing some pain in pregnancy. You can, definitely. But this is for the program is for the active mom that wants to stay active, not just during pregnancy, but being able to work up until they deliver, or have a really easy postpartum recovery, or trying to avoid medical interventions in birth, because that's kind of my story. So I did Genevieve's birth story in a podcast episode, and that's the birth and that kind of thing. But I'm a single business owner, not single. I have my husband is a great support system, but in the business, at the time it was just me and Bruno, my dog. Had a medical biller, but not on site. So it was really up to me to, keep my business moving along, and I wasn't able to take very much time off. Not that I suggest that. I want people to have grace with themselves and all of that, but for myself, it's always kind of a different story. But I knew that I wanted to train for birth like it was going to be the biggest physical event that I was ever going to do. As in the decision of trying to avoid a C-section and that kind of thing, I decided to go the route of natural childbirth without any epidural or pain meds or that kind of thing, because there is that slight increase of risk of C-section, and if you have major abdominal surgery, you're going to be off for longer than otherwise. So I knew that I was going to try to do it naturally. I've never really experienced a ton of pain in my life, so I was a little bit nervous as to, I've never had pain per se besides chronic headaches. And I was worried that I was going to be a big baby and not be able to do it. So I was training for this birth like it was my marathon, even though I hate running. I love to work out, I hate to run. So I looked into all different sorts of what is the best rehab. Now that would be like rehab, prehab, like you're doing it to prepare for something that would set me up for success, because I knew there's certain pregnancy pitfalls that I did not want to deal with. We've got different pregnancy pitfalls that I'm talking about are pelvic floor dysfunction, so leaking urine, hip pain, SI joint pain, low back pain, not being able to stand for very long, not being able to walk for very long. I'm on my feet a lot of hours a day and working on patients a lot of hours a day. So it was just not going to be acceptable to my schedule if I couldn't treat 20 patients in a day and be on my feet for 12 hours and moving. So I needed to set myself up for success and train like the dickens. Another pregnancy pitfall besides the pelvic floor stuff would be the tearing of the abdomen. And, you know, there's two sides to this. The vanity side, like I definitely didn't want the abdominal gap happening. But then also the biomechanics part of it. I've seen a ton of people in my office with diastasis recti, and that would be that tearing of the abdomen. And they're not really concerned with that, and they don't even know that that's what it is that they have. When you go to lay down or sit up on a bed or a table, you'll see like a doming sometimes or a tenting in your shirt, and they notice that it's there, but they don't know what it means. And that is the tearing that's happened that's created diastasis. And I have that. It's not just for women that have had kids. It's also in men or women that haven't had kids. But they know that it's there, but they don't know what it is. And they don't know that it might be causing their back pain because they're seeing it in the front and they're not realizing that it's like this weak spot in their core that's giving them low back pain or SI joint pain, or worsening their pelvic floor issues. So vanity, I didn't want a big pouch on my stomach, and I didn't want back pain because I don't have a desk job. I have a very active job, and I do not want back pain. I've never really had back pain, but I definitely didn't want back pain to limit the career I've worked so hard on. I did not want that. And I've talked in other episodes about my hip pain, and diastasis recti can also affect your hip pain, and so can pelvic floor dysfunction can affect your hip pain. So I did end up having a minor diastasis recti and a little bit of pelvic floor hypertonicity. That mine is like linked to stress. I am a glute gripper, clencher, and I have to work on that and work through stuff like through there. But those things, I didn't want those things to affect my work and, you know, the hobbies that I love. Because at the time when I was pregnant the first time, I was very, very into a heavy, active yoga practice, and I love yoga, I still do, and I didn't want it to hinder the stuff that I like. Now, did I modify things? Of course. Things that you don't look actually that hard, I modified, and things that look to some people, seeing a pregnant woman do handstands and forearm stands, they're probably thinking, what is wrong with this lady? But those actually didn't affect me in a negative way at all. So everyone is very individualized in the kinds of modifications that might be necessary for them. So I wanted to be able to do the hobbies that I loved and not have my career turn into a dumpster fire and not be able to treat my patients. So those were huge motivators for me to research and take more coursework and train like a crazy person for birth. Some other pregnancy pitfalls would be, you know, besides the pelvic floor issues, the diastasis recti, the abdominal gapping, low back pain, hip pain, and then as your center of gravity shifts, I found I wasn't expecting this. I do, had seen this in patients before, but I am prone to headaches from high school and on, and I think it's my inability to manage stress, and I definitely try to work on that. Can't stress enough, how stress directly affects how we feel in our musculoskeletal system. They're connected, you cannot deny it, the research is there. But so headaches are like my weak spot. And in pregnancy, as my center of gravity shifted and things like that, I would get headaches, and you can't take anything when you're pregnant. So there were certain things that I would do to train for reducing those headaches too, because for me at that level is debilitating as well. It's hard to concentrate on what a patient is saying, and you really want to be present for when you're with patients, because they're having an issue. They're there for seeing you because they are struggling and they're in pain, and they need you to be 100% present, not struggling to get through the treatment because they're in pain. So that was like an unforeseen thing that probably was harder for me than any of the others. With the diastasis, I was a little worried, to be honest, that it was going to be bad for me, because I was a very intense exerciser when I was younger in college and grad school, and I did what I see my patients do all the time. I hammered the crunches and rectus abdominis work all the time, and that would be the six-pack area, so the muscles that run perpendicular to the floor. And when you overdo it with those and the other things are not balanced, sometimes you can have that tearing. I literally caused diastasis on the upper part for myself by not doing balanced core work. And I see a lot of low back pain and SI joint pain with people that have an imbalanced core routine. And it's something that is very hard to get people to step back from, because I think they really hold on to wanting to work on that part of their body. But really, working on your obliques and transverse abdominis helps with more of a functional core, and it also works on your core from a vanity standpoint. And to be honest, this is off topic, but you can't sit up your way to better abs. That is a dietary thing. Everybody has ab muscles. We all couldn't function without them. They're just under some layers of stuff. So that's besides the point. So I wanted to be extra careful about doing the exercises that I needed to reduce the stress of diastasis recti. Now, I'm not saying that you can avoid diastasis at all during pregnancy, because everyone, almost 99.9% of people have some separation, because it's physics. You only have so much space for baby to grow. There's gotta have some opening happening. And it's how severe is it? Can you reduce the severity? Because if you reduce the severity, it's going to be easier to fix after. And being aware that some people have a very minimal diastasis during pregnancy, and then they have the baby, their center of gravity shifts, and then they get an even greater diastasis because they jump into the incorrect core work too quickly. And you don't have to avoid core work. It's, are you doing the right core work? So that's important as well. So what I'm working on now, as I've kind of learned the downside of a monthly membership with not as much one-on-one to it, is that it's hard for people to stay consistent and do things self-paced. And so I'm working on a 12-week course for pregnant people to help them reduce these pregnancy pitfalls, have a natural birth, and get back to their career, their hobbies, their other kids as quickly and safely as possible. And it's going to be way more high touch. So meeting with me twice a week in a group setting to kind of see what questions you have, and questions on the course material, questions on your own pregnancy. And I think it's going to be a great way for those people like myself that were looking for, like, tell me how to train for this. Tell me how to empower myself in pregnancy, because I'm not the type of person that wants to just sit back and relax, because pregnancy is not the time to sit back and relax. Pregnancy is the time to be like, okay, we need to do our best to be so active and train for this huge event that we're going to do. So that is what I've been working on, and I am looking forward to having it come out. So if you have any questions about it, feel free to, I'm scheduling free calls to answer any of your questions about the work, and I'm really excited about it. Let me know if you have any questions. Have a great day.